Welcome back, everyone, to On Board with Public Health. Dumitru's here, and thank you very much for joining us again. Today, we are diving into something that's the very heart of the food safety, the 5 major factors identified by the Center of Disease Control, CDC, that contribute to foodborne illness outbreak. The CDC, working together with the Food and Drug Administration, FDA, and other federal agency over many years, have published the FDA Model Food Code to provide recommended requirements and intervention to address this risk factor to help prevent outbreaks. There is no coincidence that Chapter 7 Food Safety in the Vessel Sanitation Program VSP 2025 Environmental and Public Health Standards is based on the FDA Model Food Code. As we discussed in our first 2 podcasts, the operation that employ 2 key concepts in Chapter 7. First is 1, demonstration of knowledge, food safety knowledge, is found in the section 7.1.1.1. And second, performance of duty, food safety monitoring duties, found in section 7.1.1.2, are associated with an operation that has active managerial control to prevent outbreaks. These are areas where things can go wrong quickly if we are not paying attention. But also there are areas where good practice and leadership make all the difference. Captain Thomas, my colleague and friend, is here with us once again. And I'm excited because I know from both shipyard operation and inspections, understanding and addressing these major risk factors are key concepts we live with on board every day. Captain Thomas, welcome with us back again. Can you introduce us the 5 major risk factors? And then together, perhaps we can go into more detail with an example.
Well, thank you, Dumitru. It's always a pleasure to be with you. When a USPH officer comes on board and conducts an inspection, or when shipboard personnel are conducting a self-inspection, the 5 major risk factors should be front of mind. When making an observation, always ask yourself, what is the risk? So let me run through the risk factors quickly, briefly, and then we'll walk through them with an example. So number 1, we call improper holding temperatures. And here we're talking about hot foods, cold foods, cooling and reheating foods, keeping foods out of the danger zone, or using time as a public health control. Number 2 is inadequate cooking, not cooking to required temperatures to destroy pathogens of concern. And risk factor number 3 is contaminated equipment and cross-contamination. Here, we're talking about transferring pathogens from unclean equipment or from one food to another. And 4th is unsafe food sources, simply foods from unapproved suppliers. And last, number 5, is poor personal hygiene, including hand washing, gloving, clean equipment, jewelry, that sort of thing. And, you know, I would be remiss if I didn't mention an emerging risk factor, the 6th risk factor, which is lack of a positive food safety culture. That's how and what the officers and crew think about food safety. If the VSP standards are embraced, a positive food safety culture exists. If not, the possibility of a foodborne illness outbreak increases.
Excellent, and thank you, Captain Thomas, for adding the 6th risk factor, lack of positive food safety culture. Those 6 risk factors tell the story. And let's not forget, all of them, they are linked directly to active managerial control. It's not about just checking off boxes, but supervisors and managers setting the tone, performing their monitoring duties, acquiring and providing proper training, knowledge. It's about line staff having clear SOPs and promoting a culture where food safety is their second nature. So, Captain Thomas, let's start with the first one, holding temperatures and time control, specifically using time as a public health control. For me, this is such a big one on cruise ships. I remember buffets were a few minutes here or there. They have stretched into 20, even 25 minutes past the 4-hour documented discard time. And if you have potentially hazardous foods, known as time temperature control for safety foods, whereby bacteria growth or toxin might have reached a level to make someone sick, that's a 5-point critical violation.
You're right, Dumitru, and that's where complying with the new VSP 2025 standards is critically important. Using time as a public health control, allowing potentially hazardous foods, known as TCS foods, to be held in the danger zone requires a time control plan. It's important to have an understanding of bacterial growth and the time or temperature it takes for them to grow or produce toxins and make people sick. Following the 4-hour rule, allowing potentially hazardous foods known as TCS foods to be held at any temperature, you can hold food without temperature control, but you must discard it within 4 hours when the time is up. This applies to both hot and cold foods. Now with the new 6-hour rule, which is in section 725.3.5, potentially hazardous foods, known as TCS foods, can go 6 hours, but you need to monitor and maintain records to show that the food never exceeded 21 degrees Celsius, which is 70 degrees Fahrenheit. This new rule applies only to cold foods, not hot foods. What matters most here is not whether the inspector catches you at 25 minutes beyond the limit. It's that the pathogenic bacteria that make people sick don't care about excuses. When potentially hazardous foods, known as TCS foods, are time or temperature abused, people can get sick. Active managerial control means making sure the buffet supervisor is conscious of the clock, is complying with the time control plan, owns the process, trains the team, and promotes a positive food safety culture.
Exactly, Captain Thomas. And I can tell you, when the crew see that the manager is treating time logs with integrity, with respect, instead of busy work, suddenly everyone else respects the logs and the time control plans. Is when we ignore it and we have a negative food safety culture, that things slip. Now, Captain Thomas, let's move to the second risk factor, inadequate cooking. I've seen this often with fried eggs. And I like always to pick on the fried eggs. A sheet pan of fried eggs is rushed out into the buffet line, but they do not have been cooked to required temperature, which is found in the section 7.2.4.1.1. The temperature required is 68 degrees Celsius, which is 155 Fahrenheit. Using a thermometer, and then yolks are still running. Remember, these are eggs cooked for later service, not to order for immediate service. There might be required consumer advisory, and the guest orders an uncooked egg over easy with the runny yolk, and there's the issue. We can't see food safety. We must use a thermometer to check the temperature. The egg might look fine, but the pathogens don't announce themselves.
You know, that's a good example, Dumitru. And that's why consumer advisories are required when you serve selected raw or undercooked, potentially hazardous foods, known as TCS foods. But consumer advisories have limited applicability and don't replace good cooking practices. Managers need to reinforce this one when it comes to eggs. There are two temperatures to keep in mind. Unless there is a consumer advisory, a fried egg for immediate service must be fully cooked to 68 degrees Celsius. That's 155 degrees Fahrenheit. If there's a consumer advisory and the guest orders an undercooked egg for immediate service, the guest makes an informed decision based on their health and personal circumstances and knowingly accepts the risk of consuming an undercooked egg. To summarize, if there is a consumer advisory, eggs for immediate service may be cooked to 63 degrees Celsius. That's 145 degrees Fahrenheit. But eggs not prepared for immediate service must be cooked to 68 degrees Celsius, which is 155 degrees Fahrenheit. Active managerial control here means having calibrated thermometers, trained staff. You have to ask, is there or is there not a consumer advisory? And supervisors monitoring the operation have to be there. It's not about mistrust. It's about building and reinforcing good habits so that undercooked food, potentially hazardous foods known as time temperature control for safety foods, don't reach the guest unless it's in accordance with a consumer advisory.
Thank you, Captain Thomas. And that brings us to contaminated equipment and cross-contamination. This will be our third risk factor. I watch in galleys, the same cutting boards was used for raw chicken and then without cleaning for fresh vegetable. There was no bad intention, probably just pressure to get the food prepared, to work quickly, and sometimes a poor setup. But that's how pathogenic bacteria like Salmonella on raw chicken contaminate the cutting boards and then the fresh vegetables, which might not be cooked.
Here's where an understanding of microorganisms and how they contaminate food, the micro world, is really important. I circle back to the criteria for managers under food safety knowledge, section 7.1.1.1. It's difficult to effectively perform the required monitoring duties described in 7.1.1.2 without this knowledge. Active managerial control in this instance means designing the workflow to prevent the risk of cross-contamination before it happens, having separate stations, one for raw poultry and one for raw produce, color coding, cutting boards, clear labeling, and effective monitoring by supervisors.
Thank you once again, Captain Thomas. Let's touch on the unsafe source. That will be our fourth factor. Most ships have a strong procurement system, no doubt about this one, but occasionally, when provision run out of a commodity like fresh fruits or vegetable, someone for provision is sent ashore to the local farmer markets to procure what's needed. They have no idea where the produce came from or the condition in which was grown or harvested. As you know, there have been many outbreaks from contaminated produce, especially berries from unapproved sources.
Yes, it's really important that foods are procured only from suppliers who are subject to jurisdictional inspection by regulatory authorities. In the case of produce, suppliers must follow good agricultural practices. The concept of safe sources also includes transportation and storage before reaching the ship. Here, active managerial control means galley managers and provision managers work together to assure foods coming on board are from approved sources only. And they're sound when delivered to the ship. A good example are fresh shellfish like oysters. Did the required shellfish tag come with the oysters? Are they alive and in sound condition? How do you store and keep them? How long is it required to keep that shellfish tag? It's teaching the why, not just the how.
Thank you once again, Captain Thomas. And finally, the last one, the personal hygiene. This is where management culture really shows itself. When supervisors model proper hand washing, glove use, and illness reporting, the crew follow their lead. When they cut corners, so does everyone else. I remember in a galley where a crew preparing food were wearing wristwatches, bracelets, and multiple rings other than a simple wedding band, make it difficult to properly wash their hands. They didn't realize that jewelry provides a harborage for microorganisms that might possibly contaminate the food, a small but symbolic lapse of personal hygiene.
You're right, Dumitru. Here's another example where an understanding of the micro world comes in. The answer, active managerial control, is training and monitoring for compliance. As you point out, if managers or supervisors practice good hygiene, the crew will follow.
Captain Thomas, what we want the listening audience to take away from this is that recognizing the risk factors and applying the VSP 2025 environmental and public health standards is not just a task. It is the foundation of achieving top performance on board the ships. When managers and supervisors embody these standards, they set the course for the crew to follow. This shared commitment builds a positive food safety culture where everyone tasks and it takes accountability, and the risk of foodborne illness is reduced.
No, the major risk factors are really there to help us to better understand the why behind the VSP 2025 standards, the requirements and interventions laid out in Chapter 7, Food Safety. Compliance with the standards impacts on the public health and safety of both passenger guests and the crew. Are you on board?
Thank you, Captain Thomas. Thank you for your perspective, and thank you to all of our listeners. You gave us your time, and we hope we give you the tools and insights that you find useful to put into practice and share with others. Thank you very much.